Welcome, everyone. I'm Dick Deming. I'm Medical Director of Mercy One Cancer Center and the founder of Above and Beyond Cancer. Welcome to our weekly cancer education series. It's brought to you in part by a grant from the Iowa Oncology Society. And our topic tonight is yoga therapy. And if you don't know what that is, well, I'm not surprised. I didn't know what it was until just a few weeks ago. And our guest is Amber Crosby. Welcome, Amber.
Thank you.
Amber is has her master's in social work and is a counselor, and she's the CEO of Ananda Mental Wellness and Yoga. And we're going to get to know Amanda. We're going to talk a bit about counseling in general, and then we're going to talk about the topic of incorporating yoga into counseling. Right?
Absolutely. Yep.
So let's learn a little bit about you. Where are you from originally?
From Clinton, Iowa. Born and raised.
Way down in the southeast.
Right on the Mississippi.
Right. And what high school did you go to?
I graduated from Clinton High School.
And how big of a school is that?
Well, today it's much smaller, probably 800. At the time that I was a student there, it was probably closer to 1,200.
Wow. So over 400 kids per class. And why is it smaller now?
I think just over time, Clinton has aged a bit. So lots of folks moving out of the community, a lot of baby boomers living there. I think its population is just shrinking.
Yeah. And when you went to Clinton High School, what was your claim to fame in high school?
Let's see. Claim to fame. I was a musician. So I sang and I played both the trumpet and French horn, studied voice privately, and sang in the choirs.
Wow. And with a school that big, did your school have like musicals and all sorts of other?
Absolutely. Yeah.
Were you in the musicals?
I did play some parts in the musical. Never anything big, more of an accessory role, which I was very much okay with.
And what was your favorite musical that you did when you were in high school?
I would have to say Joseph and the Technicolor Dreamcoat.
Then once you graduated from high school, where did you go?
I moved on to Luther College in Decorah, Iowa, where I earned my bachelor's degree in psychology and social welfare.
Okay. And big music school. So you probably continued to participate in music.
I did. I spent 2 of my 4 years there participating in private voice lessons, singing in the choir.
And did you do any, I know I've got some friends whose kids go to Luther. Did you do any tours of Europe with the singing groups at Luther?
I did not. I never made it to the Nordic choir. I kind of lost interest in it a bit before I got to that point, but would have been lovely to have.
So when you started at Luther, you knew you wanted to get into psychology, a counseling type of profession.
Actually, when I started at Luther, I'd planned a career in medicine and then decided I wasn't a fan of either biology or chemistry, which are kind of critical.
Which is really unfortunate that's kind of a barrier to so many people.
Yes. So I decided on psychology and eventually found my way into social work and social welfare.
So did you go into the workforce after your 4 years at Luther, or did you go right on to graduate school?
So I spent probably 5 to 6 years in the workforce working as a bachelor's level social worker in child protective services.
Okay. And then you went back and got a master's?
Yes. I went to school beginning in 2009 and graduated from the University of Iowa in 2011.
And when you were doing your master's, did you have a focus on a particular aspect?
Actually, my focus was on social work and healthcare settings. So I was really interested in oncology and actually completed my advanced practicum experience in the oncology unit at Mercy.
Oh, wow. I didn't realize that.
Yeah. I was there for a year working with their social worker.
And then once you completed your education, what did you do next?
I spent the next probably 5 to 8 years, 4 of which were spent at ChildServe as a pediatric palliative care social worker, and then moved on to Unity Point at Home, working with adults in home care settings, and then completed my healthcare work, spent a year at the VA working with veterans, completing advanced directives and advanced care planning.
And was that mostly outpatient or inpatient?
All of it. Well, there was a lot of inpatient work at the VA, but a lot of outpatient as
Okay.
well.
And then you created your own
Yes. So
entity.
I left the VA because I needed more flexibility. And as we all know, the government doesn't give you a lot of flexibility.
Mhm. So,
So
a
moved
mom with 2 kids in school
3
and
kids,
3
actually.
kids.
Yes. Single mom with 3 kids, decided I needed to focus on them and felt like transitioning into private mental health practice was the way to do that.
So what would you say your niche is in terms of your clientele? Is there a particular type of client that you work with most?
I seem to work a lot with individuals with anxiety disorders as their primary diagnosis. I see a lot of individuals with chronic health conditions. Work a lot with people looking for kind of just a different approach to mental health, which is kind of where the yoga piece
Mhm,
comes in.
mhm. So let's transition to yoga.
Yeah.
So we've talked to many different types of yoga instructors, and
Sure.
so most of us probably are familiar with yoga classes, where you might go to a class and you might be one of 10 to 20 people, and you're all kind of following an instructor. And
Mhm.
there's various types of yoga, but most of us probably have experienced it as part of a group class.
Absolutely.
And it was new to me that that there was such a thing as a yoga counselor or therapist.
Mhm.
So at our cancer center, we have a music therapist and we have an art therapist, and we're soon going to have a yoga therapist.
Yes.
So
Yes.
maybe talk about the evolution of this specialty of yoga therapy and what it is.
Absolutely. So I first became aware of yoga therapy in 2019 as I was doing my own yoga teacher training. All yoga teachers start out with a basic 200-hour training, which is the training that I've completed. But the individual who I studied with, she happened to be a 500 hour. So she had done 500 hours of yoga training in order to be certified to teach yoga at her level. And also, she was a certified yoga therapist. So that was where I really learned about this very unique part of the yogic philosophy, or this very unique part of yoga and yoga therapy. And it's a personalized approach to yoga. Instead of being in a big class, it's you one-on-one with a yoga therapist. So an individual with that 500-hour training and the extra training to be able to do yoga therapy. You and that person is completing an initial assessment and is determining and developing a personalized approach using yogic techniques like movement, breath work, meditation, guided imagery, all of those to address whatever the individual's identified maybe health needs or their goals might be. So the individual is maybe not necessarily a psychotherapist like I am, but they're a yoga teacher that's certified to teach yoga therapy or to be a yoga therapist.
And to use the term teach yoga therapy.
Mhm.
So when I think of like an art therapist,
Mhm.
so the art therapists I know, have an interest in art, but then
Absolutely.
get training in how to use art to provide therapy. And I'll even say what most of us would think of as mental health therapy. I mean,
Mhm.
it's not like therapy, how to get your hands to work right to do the art.
Right.
It's how to use art as part of a mental health therapy. That
Mhm.
might be a positive psychology. It's not like you have to have a mental health disorder to get mental health positivity out of
Absolutely.
it. But when you talk about the yoga therapist, it's not just like a one-on-one yoga class where you get extra special attention. Like, you take a private ski lesson. Well,
Right.
my
Right.
private ski instructor, I don't think of as a therapist, but as somebody giving me one-on-one instruction on a
Yes.
physical technique. But I think I'm hearing from you that yoga therapy is different than just a one-on-one on how to get the right positions.
Absolutely. Yoga therapy is holistic in nature. So it is focusing on the body, mind, and spirit. And the yoga therapist is pulling from their experience, utilizing movement, breath, meditation, and guided imagery as a way to improve or help the individual address whatever they feel they need to address, whether it's maybe some anxiety, maybe it's some chronic pain, maybe it's recovering from cancer. It could be any number of things that the individual presents to the yoga therapist wanting to address.
So I would assume that first meeting, you don't just get in downward dog position and figure out the best
That is
position.
true.
There's probably a bit of a conversation that happens.
Absolutely. The yoga therapist sits down one-on-one with the individual to really gain an understanding of who they are, what their struggles are, what their goals are, and then works with that individual and empowers them through yoga to meet their needs.
So I would, just having been in beginning group yoga classes, I would imagine there's sort of beginning breath work and beginning positional work that you might do with anyone. But as you become a yoga therapist doing one-on-one, are there different strategies in terms of which techniques of yoga you might incorporate for someone who is experiencing anxiety or experiencing depression or experiencing fear?
Absolutely.
Or experiencing loneliness? Or do you adapt the actual physical postures to accommodate certain emotional states?
Yeah, I think the yoga therapist is attuned to really what postures are even appropriate, first of all, for any of those needs. There are different yoga postures that you might use that are more energizing. There are ones that are more relaxing. There are ones that, touch different areas of the subconscious that maybe we're not even aware of. And that's where the yoga therapist's training comes in handy, right? They have knowledge and expertise of yogic philosophy, extending back thousands of years. So they have a lot of knowledge about what to use, when to use it, how to use it, what's appropriate, what's not appropriate, in order to hopefully achieve the result that they're looking for.
So, Amber, you are a mental health counselor before you became a yoga therapist. So, I could imagine that you might incorporate, talk therapy, cognitive behavior therapy, all sorts of different theories that are unrelated to a yoga posture when you're working with someone. But I would imagine there are others that come into this from a yoga experience that don't have a mental health counseling background.
Absolutely.
So would it be fair to say that they do less talk therapy and are more trying to use the body and positions to help relieve certain states of anxiety, fear, depression?
I would say yes. And that's where the distinction lies, that yoga therapy is not traditional therapy. And that's a very important distinction. You're not necessarily going to go to a yoga therapist for treatment of a mental health condition exclusively. It's meant to be more of a supplement to the work that's already being done by a therapist, a psychiatrist. And then here's this other great service, just like, you're integrating all kinds of other services at the cancer center, or art therapy, music therapy. It's meant to complement the work that's being done in Western medicine.
Your training, so obviously, I would assume that before you started getting hours as a yoga instructor, you had an affinity for yoga. You found that it was helpful. Maybe talk a little bit about your yoga experience first.
Absolutely.
As a student and a participant, and then what you found was so helpful that you wanted to, in your busy life with 3 kids and a profession, get into adding hours to learn how to be a yoga instructor?
Yes. So I went to therapy, just regular psychotherapy, for the first time in 2015. And it was then that I realized that for years I'd been struggling with generalized anxiety disorder. I always knew there was something there, but never had the words to put to it because I'm a child of the 80s. And at that point in time, you didn't go to therapy. You didn't talk about things, right? You just kind of like pushed it away. And it just wasn't a thing that people did in the 80s and the 90s and before, So 2015 rolls around and I'm really experiencing a lot of generalized anxiety, started therapy, started taking medication. And then, sadly ended up getting divorced between 2015 and 2019. It was then that I decided I really wanted to. I had used yoga, participated in yoga classes, but in 2019, when I was kind of branching out on my own, really knew that I wanted to become a yoga teacher. And I wanted to integrate elements of yoga into my practice as a psychotherapist because I myself had enjoyed the benefits of breathing, meditation, guided imagery, movement. They all made me feel so much better and really, again, supported the therapy, the medication that I was already doing as part of my treatment for generalized anxiety. So I completed my 200-hour certification and started my practice and started integrating those elements of yoga into my work.
Tell us a little bit more back to your experiencing yoga before you got into the training to become a yoga instructor. How many sessions, how many years, how long did it take before you were able to realize that this was not only making you more flexible, and I know that's not the purpose, but that it wasn't only changing your body and you were easy, but that you were experiencing a relief of mental oppression, and or finding joy in the practice of yoga?
Well, as an anxious person, I actually didn't go to a lot of yoga classes. Why? Because my anxiety told me I had to look a certain way, I had to move a certain way, I had to be wearing the right pants, I had to be bringing the right equipment with me. But in the moments that I gave myself the permission to try it and to push myself out of my comfort zone, the relief was incredible. It was a decrease in symptoms of anxiety. So I felt calmer, I felt more relaxed, I felt more flexible because I had moved my body in a way that was mindful and purposeful and just felt good, something that I hadn't experienced before. And in those classes that like I said, that I did give myself permission to attend, I knew it was something. And that's why I felt like when I was finally ready to really push myself out of my comfort zone, I knew it was time to teach.
So as you're going through training to become a teacher, I would imagine you have to teach.
Yes.
You can't just learn to be a teacher without
absolutely
a little bit of student teaching or practice.
Yes, you cannot.
Right. Because you have to learn the practice of yoga, and then you have to learn how to teach it to someone who doesn't know.
Yep. And so I remember that class in our school where I did my training. We had to teach all of the other members of our class. So we had to go start to finish for an hour-long yoga flow and make it something. And I remember I had like a binder. Here's the anxiety piece. I had a binder with notes of every single thing down to like how many breaths, how many counts in this binder. It was seriously like 20 pages long. Not a very cool yoga teacher that's like standing there flipping through the pages in their binder. It ended up being a really great class, but I was petrified and I just needed that binder was there. And then over the course of the next few years, I did some work with my own personal therapist, and we decided, for me, it was time to just let go of the control and to just put myself out there just as I am. And so when I really started my yoga or my mental health practice, and I was out there on my own, I started teaching what I branded as imperfect yoga. So it was come as you are, come as you want to be. I didn't have any notes, which I will tell you was like absolutely petrifying, but it was just what came to mind in the moment, what felt good for my body in the moment, what felt good breathing. And I just put it out there, and I might have messed up. It might have been a terrible class, but it got easier. And I mean, now I've taken my yoga to the football field of Sadell High School, and I'm teaching 45 young men yoga on the football field. Talk about like totally outside of my comfort zone, but there are no notes. And we're just moving in a way that feels good for the body, mind, and spirit in that moment.
So it's one thing to get the training and be a yoga instructor, but you also need a class to teach.
Yes.
So, I mean, before you are considered a yoga master or yogi or, whatever the right term is, and people are thronging to come to your class, you kind of have to go through that developing a group that wants you as their teacher. And I imagine when you go into private practice as a counselor, there's that same sort of thing. You have to not only be good at what you're doing, but you have to market yourself and find then the folks that come to you for guidance. So how did you do that through just the yoga part? Were you teaching at a yoga studio where other instructors?
So actually, I've never taught at a yoga studio. I've always only offered my own classes. When I got to the point where I was
in your own home,
in my own like mental health, I have a small office in Highland Park that has a small area that I was able to fit 4 to 5 people in there. So I would offer what I called, as I said, imperfect yoga, and it was a donation-based yoga class because I felt like people paying for a service, they expect that it's going to be a good service. And since this was imperfect yoga, there were no guarantees that this was going to be a good yoga class. But I donated then any of the funds that I got to a chosen nonprofit for that month. Instead of it going into my pocket, it became, this was just an opportunity for me to push myself out of my comfort zone and to welcome others into my space. And hopefully, whether they had never tried yoga, maybe they, like me, were intimidated to go to a Power Life class or a Y class. I mean, they are all great classes. But for me, it was just so overwhelming because, like I said, I felt like I had to be doing it right and looking a certain way in order to fit in. So with the imperfect philosophy, it became just wear what you want as long as you have clothes on, and just move how it feels good. There's nobody lined up in a row watching what you're doing. You just move. So that's kind of how I did it. And then eventually I had to stop with imperfect because life got busy. And then I was diagnosed with breast cancer last year. So that
there's a little bit of a bump in the road of life.
Yeah, just a little, as everybody here knows.
So
yeah.
Are you comfortable sharing a bit of that? So did your journey begin with like a screening mammogram, or was it you detected an abnormality?
Yeah, so I had no clue there was anything there. I had gone in last February of 24 for my annual screening mammogram. And incidentally, the screening mammogram in 23 was the first time I'd ever had a normal mammogram. I had heterogeneously dense breast tissue, so I was always being called back for ultrasounds and follow-up mammograms and all the things. So in, like I said, February of 24, went in for my screening mammogram, and that was where they found a lump that was about the size of a kiwi at the time they found it. So I had gone a year from nothing to kiwi-sized tumor in my left breast.
Why do you say kiwi instead of a plum or a lemon or?
Well, because Google told me that when I was going down the rabbit hole, that my specific size tumor was the size of a kiwi.
Okay. You didn't spend time in New Zealand.
No, I did
No.
not.
Just,
Google told me so.
I'm sorry to go to. It's just that
No.
seems like an unusual fruit to
I know.
compare your
I
tumor
know.
to. So
It was an unusual tumor.
and you couldn't feel it. Your doctor couldn't feel it, but because you had dense breast,
Mhm.
the mammogram suggested you had a tumor the size of a kiwi in
Mhm.
your breast.
Mhm.
And so the next step was a biopsy.
Well, yes. So that day they scheduled me for the biopsy, and I went in to the biopsy, and you just see it on the radiologist's face. Like they just know there's something there. They're not saying anything, of course, but I think by the end of it, it was pretty clear. And I remember the nurse or the assistant who was in the biopsy with me said, yeah, there definitely is something there. So we left that, kind of got me cleaned up. And I remember sitting kind of in the radiology area of the Iowa clinic, and they're just I'm waiting, and, they confirmed that there was something there, and it was time to get scheduled with a surgeon. And that was really my first step after diagnosis.
And then the treatment path, was it surgery first or chemotherapy first?
So when I officially was diagnosed, I was resolute that I was just going to go forward with a double mastectomy. I think had there been any kind of like, oh, well, maybe not. And had I opted for a lumpectomy, they would have definitely gone chemotherapy, radiation first. But since I knew what I wanted, we just went for surgery. And I had a double mastectomy with immediate reconstruction on May 9th of last year.
Okay. And then that was followed by chemotherapy?
Well, all of my scans prior had indicated the cancer hadn't spread to the lymph nodes. However, when general surgery got in there, surprise, surprise, this little kiwi-sized tumor had started its path into the lymph nodes. So I bought a ticket to chemo and radiation. I did 4 rounds of chemo, 2, and then I was hospitalized for a week, and then 2 more. And then 28 or 29 radiation treatments.
And then anti-estrogen treatment following that?
Yes. So I opted to have my ovaries and fallopian tubes removed. That happened the day after Christmas. And then in January, I started the anastrozole and Kisqali.
Mm-hmm. So fairly long journey.
Yes.
And as you're going through this, you're a mom.
Mm-hmm.
And by this time, have you remarried?
Yes, I'm married to a wonderful husband.
And you've got your own business.
Mm-hmm.
So did you put that on pause, or were you able to continue to do counseling during the course of your chemotherapy and radiation?
So I was lucky that my oncologist and I worked together to develop a plan so that I could work during chemo. So we set my infusions for Wednesday, and I took that day off of work. I went to work Thursday and Friday, and then Saturday, Sunday, Monday was really when the lethargy and just the icky feelings kind of came on board. So I used the weekend after infusion to recover and get ready for the next week and the next round 3 weeks later.
So how does someone who's a professional counselor who has a history of general anxiety disorder, who's just had node positive cancer, where it would be a normal thing to experience fear of recurrence, how do you become present for someone else in the room?
I would say in the year of my cancer journey, I never really gave myself the opportunity to sit with that. It was just, my husband was like, oh, well, we just have the days when we embrace the suck and we just keep moving forward. And so I think for that year, that's pretty much what I did. I mean, I was seeing clients virtually a week after my mastectomy, and I went to work the next day after I had my ovaries and fallopian tubes removed. I wasn't on any narcotics, so just so you and I just kept going. And I think really now that the dust has settled, that's really, I think, ironically, things came together in a way that the cancer center reached out about yoga therapy. And Kylie very kindly said, well, maybe you should come to the Richard Deming Cancer Center and see what we're up to. So I did. And the last few weeks have been incredible, and just actually feeling seen and heard and being able to process some of the emotional stuff that I didn't take the time to process in the midst of it all.
So I imagine in some ways going back to work was grounding for you. I
Mhm.
mean, you were present and it took your mind off your own when you are professionally helping someone else and you're present, they become the focus, and you get professional comfort in doing what you do well, and it takes your mind off your own. But there probably is some delayed processing that happens when you put that off.
Yep.
Did you have your own therapist at this point in your life?
I did. So thankfully, I was well established with a therapist. I had seen her for a couple of years at the time of diagnosis. So she was able to help me kind of deal with the immediate stuff, like the fear and the anxiety surrounding the mastectomy and chemo and radiation and all the things. And incidentally, she also helped me manage my dad's, because he was diagnosed with rectal cancer a week after I was diagnosed with breast cancer. So my dad and I, it's not ever a journey that you want to walk together, but we did it. And so she was there to help me manage my own fear and worry, and also to help me manage the fear and worry of having a parent diagnosed with cancer as well. Unfortunately, she retired the end of December, so I lost her, and I've been kind of without a therapist for a bit, but am seeing the therapist, Julie, through the Cancer Center for the time being, and then we'll move on and find somebody that seems like a good fit for the long term.
Okay. So thank you for sharing all of that.
Absolutely.
And then back to the yoga therapy.
Absolutely.
Did you incorporate yoga therapy into your regular patient clientele that were coming to you for regular counseling? Was that something you introduced to them and just became seamlessly part of how you did therapy?
So, since I'm not actually a certified yoga therapist, there's a person working for me who is. For my work as a psychotherapist, I integrated elements of yoga into it, in particular, breathing, grounding exercises. Actually, there were a few clients who were very interested in trying movement as well. So there were times when we unrolled the yoga mats and we kind of got down there, assuming they were able to, and we kind of just utilized some postures in the middle of psychotherapy sessions. Is very much a therapeutic technique. And that was what really kind of sets me apart as a psychotherapist. Is I'm a therapist by trade, but I have this yoga training that I can actually do that safely in the space of a therapy room. And I have the requisite experience and training versus let's try this without any training or
I would
expertise.
imagine that it's more common that a yoga therapist is someone who is really good at yoga, is a yoga instructor, and then transitions to this one-on-one yoga therapy, more focused on the yoga and not on the other psychotherapeutic techniques of talk therapy, if you will, or cognitive behavior modification and the various other
Yep.
theories of helping people through talk.
Yep. Yep.
Okay. Now, how did you come across the yoga therapist that you work with?
Yes. So her name is Jenna, and anybody that participates in yoga therapy at the Cancer Center will have an opportunity to meet her. She is a lovely human. She came to me as a temporarily licensed mental health counselor, and she was seeking clinical supervision. And since I am an LISW, so a licensed independent social worker, I can provide clinical supervision to new therapists in order to help them obtain their advanced independent licensure. So that's how she found me, again, because of the yoga background and having that on my website and letting people know that's kind of what I do as part of my psychotherapy sessions. That was really what piqued her interest in coming to my practice. And so she and I worked together, me as her clinical supervisor. She was working at another private practice at the time, and I was just providing her supervision. And then last summer, I think maybe early fall, she decided to leave that practice and asked to come work for me exclusively. So together she's seeing therapy clients, and she's also completing her hours for her yoga therapy training and doing all the things that she's doing. And we just kind of came into this lovely opportunity to be able to support folks at the Cancer Center.
And as two individuals that are trained in different ways, both do therapy, I mean, do you assist each other? Do you, when it comes to yoga therapy, are you a client of hers? Is she a client of yours? What's the ethics and the around that whole of being friends versus being clients and therapists and colleagues?
Yeah, we are colleagues exclusively. I offer her obviously clinical supervision, and I'm there to process cases and kind of process the challenging things that she's experiencing as a temporarily licensed mental health clinician. I've actually never done yoga with Jenna. We talk yoga and talk shop, but neither of us have ever worked with each other as like, I've never been her student. She's never been my student. We've kind of just worked together on a purely professional level.
Do you still have a yoga practice, and is it solitary, or do you have a yoga instructor or a guru or yogi that you go to?
So I right now just work with myself in yoga. I have a pretty, I can say it's established. It's not always regular, which I always say, I don't know why I don't do it more, because I always feel amazing after. I spend a lot of my time as a yoga professional right now, like I said, bringing yoga out to the community, to individuals that wouldn't necessarily be able to access it. And that seems to have fallen kind of in the way of working with young high school athletes, and teaching yoga, working on athletic performance. I've kind of found another little niche area where
Kind of
I'm
like sports psychology?
a little bit. I have actually a certificate from the University of Michigan in sports social work. It was a postgraduate certificate I earned.
So how would sports social work differ from a sports psychologist?
Well, I'm not a doctor, so that's the major difference, right? Most sports psychologists are like
PhD sort of people.
Yeah. So it's just really degree of
but
education.
The same type of work.
Similar work, just a little different
How do you not
bend.
choke in a big situation?
Kind of.
I mean,
yeah.
That's,
yeah. So
do you work with the quarterback? You work with
like I said, every Thursday, Sadell High School. I have
sports psychology kind of.
Yep.
Okay.
So
and yoga. So that's kind of all of one thing. It's not like, oh, you work with this person one-on-one with the sports psychology and another person with the yoga. You kind of do the whole group.
Yes.
It's a bit of physical, but also talk.
It is. So with the basketball, I've been working with the Sadell girls basketball team for the last 3 years, and instantly my daughter plays for the team. And so that's kind of how I worked my way in there. But initially it was just yoga and they loved it. The coach said, every time we have yoga, our practice afterward is the best of the entire week. Well, I wonder why, right? Like you're moving your body in a way that feels good, right? You're breathing, you're finding an opportunity to relax without distraction, especially for high schoolers who are like this all the time. This is an opportunity for them to have a few moments of still where they don't have a distraction. They don't have something requiring their attention. And then this past season, we actually we added a mental health group, and I started doing mental health Mondays with the basketball team. So for 15 minutes, approximately every Monday, we would meet in the gym before practice and talk mental health. And it might have been maybe I came prepared to talk on a topic, or maybe it was just 15 minutes for them to have space to talk about maybe what they needed to talk about. And I loved seeing the girls kind of go from this state on the very first one where it's like, oh my gosh, I can't believe we're doing this, to by the end of the season, they were actively engaged in the conversation, asking questions, talking about things that were bothering them. And I'm seeing it now. We're using a similar model with the football team this summer. And we did our first 15-minute mental health moment this past week, and I was completely shocked.
So describe a little bit. How did you start it off?
So we had never had a boys team that was willing to try it. And this coach came to me and he's like, yep, my boys are stiff as boards. We're going to do this every week. And so when we added this 15 minutes this past week, I have an intern working with me currently, and she came prepared to talk on a topic. She had a quote from an NFL player, and we just kind of started asking questions. And
what was the topic?
I think it was just kind of a general introduction to like anxiety, and have you ever felt this way on the football field, or as you're like watching all the people in the stands, or maybe you drop a pass or something happens. It was just kind of like helping them. And this is again where the yoga comes into play. What's your body telling you? What are you feeling? What are you experiencing? What do you notice when that happens? Well, that's maybe a little bit of anxiety. And here's what we can do to help you with that. And then we finished that 15 minutes. And I mean, these guys are engaged, and they were like actually really excited to move again, which I was completely shocked.
And are you doing this indoors or outdoors?
We're doing it out on the 50-yard line.
In 90-degree heat?
Yes.
Yeah.
It was very hot on the turf last week.
Wow. Well, I would like to continue our conversation, but I know we have a live studio audience, and I want to open it up to questions.
Great.
So if we're going to let the live studio audience have first shot at the questions. And if you're watching us live streaming right now, please put your questions in the comments section, and we'll start with you, Angelina.
Hi. Yes, I used to do like yoga, watching on YouTube and doing some things, and that was my anxiety, is seeing how everybody's dressed. Am I have the right body type for it? So there's that stereotypical thinking of, oh, you got to look this certain way.
Yeah.
So when Dr. Deming mentioned this, I said, I'm really curious about this.
Yeah.
So that question is what would be the type, like somebody who has to utilize a cane to keep their balance, can't do those things like with the mats or crisscrossing their legs would be hard on their knee joints. What kind of examples would you do for someone like that?
That's a great question. And one thing that has become really popular in yoga is chair yoga. And so Jenna, as the yoga therapist who will be working at the Cancer Center, she knows these things and will be able to modify a posture to be able to do it in a chair versus getting down on the ground on a mat. This is one thing I think that yoga yoga folks are very attuned to is, how is the body moving? Are there any limitations? Are there any restrictions? Because we never want to put you in a position that we're saying, well, you should get down on the floor and do this, when you're maybe not able to get down on the floor and do that. And so chair yoga has become really popular. And there are a lot of postures in yoga that are very powerful, that are standing on your own 2 feet using your arms. So there's are ways to address, I think, any mobility and movement limitations.
And I would imagine in a setting with yoga therapy where it's one-on-one,
Absolutely.
the instructor doesn't have to worry about trying to accommodate 10 different individual situations. We have one person who wants to do the inverted handstand in lotus position, and the other wants to sit in the chair.
Yeah.
So you can really personalize it when
Absolutely.
it's one-on-one. Yeah.
And the lovely thing about this is you would come away from your sessions with Jenna with a personalized plan that you can take from the setting at the Cancer Center to your own home. She would tailor that plan for you and teach you and help you know how to do that safely in your own space.
Is Jenna doing like 4 sessions with cancer patients?
Yeah,
Or
I
is
think
it
we said
just
3
one?
Yeah.
to 4.
So Jenna will be starting in July, and we don't have the exact date. And the model will be similar to what we do with art therapy and music therapy, where individuals will have several sessions. And part of how many sessions will depend how popular it is, because we don't want to have so many sessions per individual that other individuals have to wait months to get a session. So we haven't been exactly firm on that, but it would be several sessions per individual, one-on-one with Jenna, who will be our yoga therapist. Yep. Yes, George.
I've always been curious about yoga and the particular benefits of it for cancer patients, as an example. If you've got cancer, fear and anxiety is maybe number 1, or if not number 2. Then, of course, you've got the pain and discomfort element
Absolutely.
of it. Well, is yoga best for one or the other, or?
It's best for both. The movement obviously can help with the pain, as actually can the meditation, the guided imagery, and the breath work. It also is very effective at alleviating anxiety. You know, what's happening is you are utilizing a lot of breath practice, and breath deactivates the sympathetic nervous system. So that part of the nervous system that says, there's danger here, you need to get the heck away, the breath turns that off. So that's why it's effective at addressing especially anxiety. And I mean, you're probably in that very same state when you're experiencing chronic pain, right? Where your body is perceiving this pain as a threat. And so you're kind of in this sympathetic nervous system activation, and that breath and that movement, but primarily the breath, will help turn that system off and say, no, you're safe. And the movement obviously helps with stretching and flexibility, and just feels good to move.
And in the science of integrative oncology, where at cancer centers, clinical trials have been done, yoga is one of the more studied forms of integrative oncology, where it has shown benefit in both reduction of anxiety and in reduction of pain. So there's a body of scientific evidence showing that it can be successful in both of those realms.
And I got to ask a comment, or ask a question, maybe make a comment. High school football. I was in high school football a long time ago, but high school football players were not very touchy-feely, intellectual type guys. I mean, if there was any touchy-feely stuff, it was brutality mostly. So has that changed? Or, over time, are young men less like that today, or are they just following their heroes? You mentioned, NFL players and that type. They use yoga.
Yeah.
They like yoga.
Yeah.
So is that why they're more susceptible or prone to using yoga today?
That's a great question and comment. I think overall, like I said, I was a child of the 80s and we didn't do any of this in the 80s and 90s. But I think there's been kind of a cultural shift as we've become more attuned to mental health, emotional health, its effect on the physical side of things, that mind-body connection, that it's becoming more accepted to talk about feelings, to process feelings. But I also think, to your point, yes, they're seeing Tom Brady and some of these big guys doing this. They're seeing this become a regular practice in the NFL. It's used in the NCAA with multiple NCAA football teams. It's used with the United States Olympic Committee. I mean, they've integrated that as part of training for their athletes. So it's really, a shift to, this is a really phenomenal thing. Let's take the stigma away of it being a lot of women in yoga pants doing stretches and say it's more accessible. It's for 15, 16, 17, 18-year-old boys on a high school football field that maybe need to move their body and stretch and maybe become more attuned to their mind.
And I would imagine that it was, a coach or an administrator who came up with the idea, not the boys themselves. Right?
It was not. The boys probably would have not picked this for themselves. But interestingly enough, my MSW intern who worked with me last school year, she and I did a survey of the athletes at the school. And several of the comments, and obviously we don't know who the people were, but they were boys, males, who were saying, we wish we had what the basketball team has. Because I've been doing this work with the basketball team. This was my third. Yeah, this was my third season last year doing it. And I think just as we've kind of worked our way into other areas, people are seeing that it's beneficial.
So some are feeling a bit left out.
Yeah, maybe so.
Okay. We have time for one more question. Yes, Jack.
I guess this is just a follow-up too, but in relation to high school sports, it seems now that people who participate at the high school level have a much greater investment in their sport than certainly when we were young and when I was in high school, you showed up. That was it, versus all the preparation that people go through for many years before they even start high school. So with that, it seems like there's more opportunity for people to experience anxiety because there's so much pressure to deliver. Yeah.
Mm-hmm. And I'm even seeing it at the level where I'm teaching, Sadell is a fantastic community, but they're not known for their athletic teams. But that being said, those boys and those girls and those young people there still experience a tremendous amount of pressure, maybe not necessarily to win, but just to perform, for their classmates, for the community. They want to be good and they want to do their very best. And they might not win games yet, hopefully, but they still are under a lot of pressure to do the things.
Okay.
So I just have a follow-up. Our son played football in 2010 through 15.
Sure.
And they were doing yoga every Saturday morning.
Excellent.
Yeah.
Oh, wow.
I love hearing that.
Yes.
Yeah.
So,
And that was Johnston?
yes.
Good.
Yes.
Good.
Okay. Okay, Angelina.
As a long time basketball player,
Yeah.
girls basketball player, and there is that competitive anxiety, stress, win, and not accepting being losing and all that. I totally get that, and I wish I had a bet. And I'm somebody from the 80s, could have used that. But I was wondering, have you done a follow-up study of how less injuries, physical injuries, may happen
that's a
through
great one.
yoga?
Yeah. Yeah. We have not explored that yet, but it's definitely something that I think is worthwhile to look into because I think you would see a noticeable difference.
Yeah. We'll do a bit of a literature search. I bet there's studies out there
I'm
looking
sure.
at the injury rate. George, before we bring it to a close, any questions from our audience? Okay. So thank you.
Yes.
Our
thank
guest
you.
has been Amber Crosby.
Thank you.
Amber is a social worker and mental health counselor and yoga enthusiast, and she introduced us to the topic of yoga therapy. And beginning in July at the Mercy One Richard Deming Cancer Center, we will be having a yoga therapist as part of our overall integrative oncology program.
Yes. Thank you.
So thank you. If anyone watching this program right now knows someone that would benefit by seeing it, it will be available on demand beginning tomorrow at the Above and Beyond Cancer YouTube channel and the Mercy Cancer Center website. Thanks for joining us. I hope you'll be here again next week. Thanks.